Occupational Therapy Certification Exam Practice Test. Question 1. Neurological. When using NDT handling techniques with a client who has had a stroke, inhibition techniques should be used for which of the following? Option A. Decrease abnormal muscle tone that interferes with passive and active movement. Option B. Restore normal alignment in the trunk and extremities by lengthening spastic muscles. Option C. Stop unwanted movements and associated reactions from occurring. Option D. Teach methods for decreasing the abnormal posturing of the arm and leg during task performance. The correct answer is option Nan. Radomski and Latham, 2008. Occupational Therapy for Physical Dysfunction, 6th edition. Chapter 24, Optimizing Motor Behavior Using the Bobath Approach p. 646. Question 2. Neurological. What is the most common factor for peripheral neuropathy? Option A. Diabetes. Option B. Lifestyle. Option C. Guillain-Barré. The correct answer is option Nan. Lori Lundy-Ekman, 2007. Neuroscience Fundamental for Rehabilitation 3rd edition. St. Louis, Missouri, Saunders Elsevier, 230. Question 3. Orthopedic. Which diagnoses is most likely to be associated of the following characteristics? Pain with resisted thumb extension or abduction. Positive Finkelstein's test can be caused by forceful, repetitive motions involving the thumb. Pain with activities such as wringing out wash rags, opening jars, and using scissors. Swelling over the first dorsal compartment of the thumb. Option A. Lateral epicondylitis. Option B. De Quervain's disease. Option C. Carpal tunnel syndrome. Option D. Cubital tunnel syndrome. The correct answer is option Nan. Rationale. Lateral epicondylitis is a form of tendinitis where there is point tenderness over the lateral epicondyle. There is no thumb involvement. Grip strength is reduced when the elbow is extended and there are complaints of nighttime aching and morning stiffness of the elbow. Carpal tunnel syndrome is a compression of the median nerve. Symptoms include numbness and tingling in the median nerve distribution of the hand, nighttime numbness, reduced ROM, and reduced grip strength. Cubital tunnel syndrome deals with ulnar nerve compression in the elbow. Numbness and tingling in the ulnar distribution of the hand is noticed. Reference: Fundamentals of Hand Therapy, Clinical Reasoning and Treatment Guidelines for Common Diagnoses of the Upper Extremity, 2007, edited by Cynthia Cooper. Question 4. General rehab. During an evaluation you test the patient's strength and ROM. The patient's right side is weaker than the left within normal limits. The patient's right upper extremity does not flex above shoulder height. You also observe the patient sitting on the edge of bed and reaching for an item on the floor. Based on the observations and using your clinical reasoning skills, what ADL can you suspect that your patient can do? Option A. Functional mobility. Option B. LB dressing. Option C. Toileting. Option D. Shower. The correct answer is option B. LB dressing. B. LB dressing because in order to dress the lower body, the patient needs to be able to reach to the floor without losing balance. Question 5. Orthopedic. An auditor is evaluating an patient and notices that the patient's PIP joint is hyperextended and the dip joint is flexed. What best describes this condition? Option A. Swan neck deformity. Option B. Subluxation deformity. Option C. Boutonniere deformity. Option D. Mallet deformity. The correct answer is option A. Swan neck deformity. Rational. The correct answer is A. Swan neck deformity is when the PIP joint is hyperextended and the dip joint is in flexion. Boutonniere deformity is when the PIP joint is in flexion and the dip joint is hyperextended. Mallet deformity is when the dip joint is flexed/drooping. Source: textbook from Dr. Flynn's class Fundamentals of Hand Therapy by Cynthia Cooper. Question 6. Pediatrics. An OT designs an evaluation group for adolescents in an eating disorder unit. The activity most useful to assess the client's task and social skills is: Option A. Discussions of reasons for admission into unit. Option B. Completion of group collage reflecting personal interests. Option C. Cooking a 3-course meal to be eaten family style. Option D. Watching a teen soap opera and discussing problem scenarios. The correct answer is option Nan. Fleming Castaldi, Rita. Endcott Review and Study Guide. Therapy Ed. Evanston, Illinois. Question 7. Psychology. An audit completes an initial evaluation of an inpatient brought to the hospital for exhibiting bizarre behavior. The patient reports he has powers that allow him to know stories about an object after he has touched it. The patient is exhibiting: Option A. Flight of ideas. Option B. Illusions. Option C. Hallucinations. Option D. Delusions of grandeur. The correct answer is option Nan. Reference: Cara and McCrae. Psychosocial Occupational Therapy, A Clinical Practice, 2nd edition. p. 121. Question 8. Management and evidence. Working in a SNF setting, you notice a patient is fatigued and seems more weak than usual. After weighing the patient, you determine that they have lost 9 pounds in the past week. What course of action should you take? Option A, notify nursing and patient's physician. Option B, consult the dietitian. Option C, discontinue the exercise and activities portion of intervention and focus on discussion/observation. Option D, all of the above. The correct answer is option Nan. Rational, failure to thrive, FTT, is common within the nursing home environment, and it is important that clients demonstrating symptoms of FTT conserve their energy. Nursing personnel and the physician should be notified to modify treatment/medications, and the dietitian should be notified to monitor calorie intake. Clients should conserve what energy they have remaining, and physical activities should be discontinued until weight is regained. Source: www.fpnotoke.com, presentation/in-service on FTT. Question 9. General rehab. Which of the following would be the least appropriate exercise program for an older adult? Option A, choose a program based on the fitness level, cardiovascular function, and musculoskeletal limitations for the person. Option B, walking, chair and floor exercises, yoga, tai chi. Option C, pool programs. Option D, repetitive programs with limited variations. The correct answer is option Nan. D, consider multiple modes of exercise on alternative days to maintain interest and reduce likelihood of muscle injury, joint overuse, pain, fatigue, and boredom. Source: PG 120 of study book. Question 10. Neurological. You are working with Mr. Brown, who recently suffered a CVA and is now a left-sided hemiplegic. While trying to complete ADLS sitting EOB, you notice that he is pushing away from his R side, strong side, and he resists attempts to correct his posture. What should you do to help Mr. Brown maintain a more upright position? Option A, keep trying to physically assist Mr. Brown to maintain midline. Option B, have Mr. Brown reach for objects toward his R side. Option C, have a family member sit on his L side to brace him. Option D, do nothing, Mr. Brown will correct his posture by himself. The correct answer is option Nan. Rationale: Mr. Brown has what is known as pusher behavior, and because these patients tend to resist hands-on attempts to correct their posture, you need to select treatments that manipulate the environment. So reaching for objects toward his R side encourages a weight shift to his stronger side, which will bring him more towards midline. It will also be important to use verbal cues. Source: Occupational Therapy for Physical Dysfunction, PG 1025-inch. Question 11. Pediatrics. When evaluating a child who is at risk for shunt malfunction, it is most important for the therapist to observe for: Option A, increased tone. Option B, decreased tone. Option C, back pain. Option D, irritability and nausea. The correct answer is option Nan. When evaluating a child who is at risk for shunt malfunction, it is most important for the therapist to observe for irritability and nausea. These symptoms can be indicative of increased intracranial pressure, which is a common sign of shunt malfunction. Increased tone or decreased tone may be associated with other neurological conditions but may not specifically indicate shunt malfunction. Back pain may be present in some cases of shunt malfunction, but it is not as reliable of a symptom as irritability and nausea. Question 12. Neurological. You are the treating therapist for recently TBI patient in an acute care hospital. Upon initial evaluation, your patient was given a Glasgow score of 9. Currently your patient is a Rancho level 6. Which would be the most effective method of intervention for your client's motivation, cognition, and memory impairments? Option A, abstract, problem-solving community reentry scenarios. Option B, higher-level money management problems. Option C, simple, everyday ADL's repetition activity. Option D, self-directed UE-ROM/strengthening exercises. The correct answer is option Nan. Neurological Rehabilitation, 5th edition. Umfred, D. A. Mosey, 2007. Question 13. General rehab. If a patient presents to the clinic in the freezing phase of adhesive capsulitis, what type of interventions should be avoided? Option A, aggressive stretching. Option B, ROM that is painful for less than a few minutes. Option C, posture education/scapular kinematics. Option D, modalities/corticosteroids. The correct answer is option Nan. Rationale: the primary treatment goal of the freezing phase is to prevent motion loss. Overstretching the capsule during the freezing phase may enhance the inflammatory process. For more information, see Chapter 10 in Cynthia Cooper text, Fundamentals of Hand Therapy. Question 14. General rehab. An OT designs an evaluation group for adolescents in an eating disorder unit. The activity most useful to assess the client's task and social skills is: Option A, discussions of reasons for admission into unit. Option B, completion of group collage reflecting personal interests. Option C, cooking a 3-course meal to be eaten family style. Option D, watching a teen soap opera and discussing problem scenarios. The correct answer is option Nan. Fleming Castaldi, Rita. Endcott Review and Study Guide. Therapy Ed., Evanston, Illinois. Question 15. Pediatrics. The occupational therapist observes that an 18-month-old child is not able to creep more than a few steps because as he looks up, his hips and knees flex and he ends up sitting with his arms extended and propped forward. The occupational therapist reports that he demonstrates, option A, the influence of symmetrical tonic neck reflex, STNR, resulting in delayed gross motor skills. Option B, typical development of locomotion skills. Option C, an obligatory asymmetrical tonic neck reflex, ATNR, resulting in delayed gross motor skills. Option D, an intact labyrinthine reflex which facilitates balance responses. The correct answer is option Nan. Reference, Fleming Castaldi, Rita. National Occupational Therapy Certification Exam, Review and Study Guide, 5th edition, 2009, pg 636. Question 16. Neurological. Which area of cognition can be described as an impaired association with neurological dysfunction, including the lack of knowledge about own physical/cognitive perceptual impairments and/or their functional implications, as well as the inability to anticipate difficulties, recognize error, or monitor performance within the context of an activity? Option A, attention. Option B, self-awareness. Option C, motor planning. Option D, problem solving. The correct answer is option Nan. Willard and Spackman, page 749. Attention involves several components, for instance the ability to detect/react, the ability to sustain attention for a period of time, the ability to exhibit selective attention or shift attention, and keep track of stimuli during ongoing activity. Willard and Spackman, page 755. C. Motor planning is the ability to execute learned and purposeful activity. Willard and Spackman, page 761. And D. Problem solving involves planning and concept. Screening adult neurologic populations, page 22. Question 17. Neurological. A patient with a CVA that has affected the left hemisphere may exhibit all of the following signs except: Option A, left hemiparesis. Option B, right hemiparesis. Option C, aphasia. Option D, apraxia. The correct answer is option B, right hemiparesis. B, C, and D are all signs that a person has suffered a CVA that is located in the left hemisphere. OT for physical dysfunction, page 1009. A. Left hemiparesis is a sign that would be present if someone had suffered a CVA of the right hemisphere. OT for physical dysfunction, page 1009. Question 18. General rehab. A patient with macular degeneration is having difficulty with meal preparation. The following are environmental factors to consider to improve the patient's ability to perform meal preparation except: Option A, changing the lighting. Option B, marking the controls with bright contrasting colors. Option C, suggest laser surgery to improve eyesight. Option D, organize the kitchen and keep items in their assigned places. The correct answer is option Nan. Reference, Occupational Therapy for Physical Dysfunction, 6th edition, p. 731-732. Question 19. Neurological. While completing an evaluation on a stroke patient, you start to notice they are having some visual difficulties. What is the most common visual disturbance that you should be looking for? Option A, diplopia. Option B, blurry vision. Option C, homonymous hemianopsia. Option D, ptosis of the eyelid. The correct answer is option Nan. Rationale: it is the most common visual disturbance associated with stroke. Source, Occupational Therapy for Physical Dysfunction, pg 1018 inch. Question 20. Psychology. A young female presents to the ER with increased sweating, chest pain, nausea and fear of losing control. She states that this has happened several times in the last 3 months and typically the symptoms subside after 10 minutes. She is scared and wants to make sure she isn't having a heart attack. After doing an EKG and several other tests, cardiac problems are ruled out and more information is sought out about her symptoms. The patient states that as of 2 months ago she has become scared to be in crowded places and avoids anywhere that has lines or crowds and avoids situations where she knows she will feel this way: supermarkets, movie theaters and buses. What is her diagnosis? Option A, panic attack. Option B, panic disorder without agoraphobia. Option C, panic disorder with agoraphobia. Option D, agoraphobia. The correct answer is option Nan. Panic attack and agoraphobia are not codable disorders. The specific disorder in which panic attack or agoraphobia occur are the actual diagnoses, so A and D can be ruled out. Because the patient has become increasingly worried about being in places or situations in which she can't escape when a panic attack occurs and she avoids situations in which she notes panic and anxiety, agoraphobia should be included in the diagnosis, which excludes B as well. References: DSM-4TR, Panic Disorder Question, http://www.uptodate.com/patient/content/topic.do?topic key $UUVUSUHJKZVSEER ampersand selected title $1 83 source =search_result schizophrenia question http://www.nihm.nih.gov/health/bipolar-disorder/how-does-bipolar-over-time.html bipolar disorder question. Question 21. Orthopedic. An author is developing an exercise program for a client with reflex sympathetic dystrophy/complex regional pain syndrome in her right hand. The client is demonstrating pain, swelling, and stiffness. Which initial exercise plan would be best? Option A. Manually manipulate the wrist and hand to increase RUM. Option B. Gentle active exercise and frequent massage. Option C. Protective sensory re-education. Option D. Relaxation training. The correct answer is option B. Gentle active exercise and frequent massage. Rational. The correct answer is B because active range of motion is crucial. Intervention that increases pain such as passive range of motion should be avoided. Massage reduces the swelling and reintroduces touching of the hand. Source: textbook Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction and the OT Advantage website. Question 22. General rehab. An author is developing an exercise program for a client with reflex sympathetic dystrophy/complex regional pain syndrome in her right hand. The client is demonstrating pain, swelling, and stiffness. Which initial exercise plan would be best? Option A. Manually manipulate the wrist and hand to increase RUM. Option B. Gentle active exercise and frequent massage. Option C. Protective sensory re-education. Option D. Relaxation training. The correct answer is option Nan. Rationale: active range of motion is crucial. Intervention that increases pain. Question 23. Orthopedic. Which of the following exercises would be a contraindication for a patient with rheumatoid arthritis? Option A. Swimming. Option B. Running. Option C. Yoga. Option D. Stretching. The correct answer is option B. Running. Answer: B. High-impact exercises like running should be avoided due to the increased stress it puts on joints. The best exercises for patients with RA are low-impact activities. Question 24. Orthopedic. A child is admitted to the hospital with a distal radial buccal fracture. The doctor asks your opinion on casting versus splinting of this patient since you are the splinting expert at the facility. You reply, option A. Casting because children are fragile and need extra precautions to heal. Option B. Casting because it is what has always been done in the past at the facility. Option C. Splinting because it will give you a higher productivity rate. Option D. Splinting because evidence has shown children heal just as well in a removable splint as a cast and have better. The correct answer is option Nan. Source: Plint, A. C., Perry, J. J., Correll, R., Gabori, I. Lawton, L. 2006. A randomized, controlled trial of removable splinting versus casting for RIT buccal fractures in children. Journal of the American Academy of Pediatrics, 117, 3, 691-697. Question 25. General rehab. Which one of the following is not a benefit of using Nintendo Wii and burn rehabilitation as an adjunct traditional therapy? Option A. Recovering from motor deficits. Option B. Distraction from pain. Option C. Fatigue and soreness. Option D. Increasing motivation. The correct answer is option Nan. Using Nintendo Wii and burn rehabilitation as an adjunct to traditional therapy provides several benefits such as recovering from motor deficits, distraction from pain, and increasing motivation. However, it does not directly address fatigue and soreness. While the use of Nintendo Wii can help improve overall physical function and engagement in therapy, it may not specifically target fatigue and soreness experienced by burn patients. Question 26. General rehab. You are seeing a new patient at your SNF who has received a total hip replacement after experiencing a fall at home. The patient is complaining of pain in his right shoulder from when he attempted to catch himself from falling. While reviewing his medical records, you see that his RU radiographs are negative for fracture. You also note that this patient had a pacemaker placed 4 years ago. Which physical agent modality is not appropriate to use to address this patient's pain? Option A. Ultrasound. Option B. Cryotherapy. Option C. Transcutaneous electrical nerve stimulation, TENS. Option D. Hot packs. The correct answer is option C. Transcutaneous electrical nerve stimulation, TENS. Answer: C. TENS. Electrical modalities are contraindicated with patients who have pacemakers or cardiac conditions. McHugh Pendleton, H., and Schultz-Krohn, W., 2006, Pedretti's Occupational Therapy Practice Skills for Physical Dysfunction 6th edition. St. Louis M.O. Mosby Incorporated. Question 27. Orthopedic. All of the following are good suggestions to provide a patient who is returning home after hip surgery, except Option A. Sit in a high stool when working at the kitchen counter. Option B. Remove all throw rugs. Option C. Use a rolling basket or utility cart when doing laundry. Option D. Place the most used kitchen items on bottom shelves and cabinets under the counter. The correct answer is option Nan. Kitchen items most often used should be placed at a reachable level, between shoulder and waist level. Following hip surgery, patients should not be bending down for things in low cabinets or shelves. Suggesting the use of a high stool when working at the kitchen counter, A. ensures that the patient is following hip precautions and is a good tactic for conserving energy. Removing throw rugs in the home, B. can help a patient to avoid tripping. Using a rolling basket or utility cart, C. to carry items from place to place will prevent the need for multiple trips when working around the house. Question 28. Management and evidence. When treating patients in an inpatient rehabilitation setting, which of the following is the most common assessment used to address daily functioning? Option A. FIM. Option B. Barthel Index. Option C. CATS Index. Option D. Klein-Bell Activities of Daily Living Scale. The correct answer is option Nan. The FIM is a basic measure of the need of assistance for a patient. It is also used in the Inpatient Rehabilitation Facility Patient Assessment Instrument, IRF-PI, which is used to determine length of stay for insurance companies. Source: Occupational Therapy for Physical Dysfunction p. 82, 83-inch. Question 29. Psychology. When working in a long-term care facility, you need to evaluate the long-term memory of a resident. Which of the following methods best evaluates memory of personally experienced events? Option A. Show the person a series of objects and ask him to recall the objects within 60 seconds. Option B. Ask the individual how he spent New Year's. Option C. Have the individual state the place, date, and time. Option D. Ask the client to remember to bring a specific item to the next therapy session. The correct answer is option Nan. Johnson, Lorch and Den Angelis. Occupational Therapy Examination Review Guide, p. 17. Question 30. Neurological. A patient presents to your clinic with complaints of persistent numbness in the index and long fingers. She reports that the numbness increases when she drives or does needlepoint. She also reports often waking up at night with pain in her hand. Which is the most likely diagnosis? Option A. Compression of the ulnar nerve at Guyon's Canal. Option B. Compression of the ulnar nerve at the cubital tunnel. Option C. Compression of the median nerve at the wrist. Option D. Compression of the radial nerve at the arcade of Frost. The correct answer is option Nan. Reference: Weiss, S. 2005. Hand Rehabilitation, A Quick Reference Guide and Review. St. Louis, Missouri, Elsevier Mosby. Question 31. Neurological. At what level of spinal cord injury is the important skill of tenodesi's grasp maintained? Option A. C4. Option B. C5. Option C. C6. Option D. T2. The correct answer is option Nan. Radomski and Latham, OT for physical dysfunction. Question 32. Management and evidence. A client demonstrates impaired fine motor function after sustaining a CVA. Which assessment would not be appropriate for the auditor to administer to evaluate the client's coordination? Option A. Box and blocks test. Option B. Minnesota rate of manipulation test. Option C. 9-hole peg test. Option D. Visual analog scale. The correct answer is option D. Visual analog scale. Rationale. The correct answer is D. Visual analog scale. All of the other choices are assessments that could give you information about a client's fine motor function. The visual analog scale is designed to assess pain and therefore would not provide any valuable information regarding fine motor function. Pendleton, H.M., Schultz-Krohn, W., 2006. Pedretti's Occupational Therapy Practice Skills for Physical Dysfunction, 6th edition. St. Louis, Missouri, Mosby Elsevier. Question 33. Neurological. Mrs. Miller is a 31-year-old female diagnosed with a traumatic brain injury. As the occupational therapist, you are using a transfer of training approach to help Mrs. Miller recover from her traumatic brain injury. You want Mrs. Miller to develop and carry out a daily schedule of activities. Which is the most appropriate to do during your treatment session? Option A. Prepare a simple meal. Option B. Organize a list of daily activities. Option C. Write a shopping list. Option D. Complete an interest checklist. The correct answer is option Nan. Pendleton, H.M. and Schultz-Krohn, W., 2006. Pedretti's Occupational Therapy Practices Skills for Physical Dysfunction. St. Louis, Missouri, Mosby Elsevier. Fleming Castaldi, R.P., 2009. National Occupational Therapy Certification Exam Review and Study Guide. Question 34. Neurological, a client has been hospitalized for surgical repair of a right side hip injury. Her medical history indicates that she had a remote stroke affecting her left side. Per her chart, this client has been advised that she should not drive due to slow reaction times and homonymous hemianopsia. Upon discharge from the hospital, she returns to her one-story apartment where she will receive home health occupational therapy. Which of the following interventions would you not incorporate into therapy sessions for this client? Option A, education of family, caregivers, and home health aid regarding hip precautions. Option B, environmental modifications, activity adaptations, and equipment that maintain independent functionality. Option C, providing strategies to the client for entering/exiting vehicles. Option D, incorporating a home exercise program that encourages hip flexion beyond 90 degrees. The correct answer is option Nan. A should be incorporated into sessions to everyone caring for the client so they can in turn provide a possibly medicated client of her hip precautions. Since she has returned to her familiar home environment, she may attempt to return to normal too soon, thus forgetting her precautions. B is important in home health OT because these items assist clients with navigating their environment independently, safely, and functionally. C should be part of a client's treatment since she still needs to attend follow-up physician's appointments, even though she no longer drives. D is the correct answer because hip precautions do not allow flexion past 90 degrees. Source: Fleming Castaldi, R. 2009. National Occupational Therapy Certification Exam, Review and Study GUID, 5th edition. Evanston, Illinois, Therapy Ed. Question 35. Psychology. A middle-aged woman comes into the hospital with auditory and visual hallucinations, delusions, disorganized speech and grossly disorganized behavior. She has a history of schizophrenia. What is known about these particular presenting behaviors? Option A. They are positive symptoms which can be reduced with medications. Option B. They are positive symptoms which cannot be reduced with medications. Option C. They are negative symptoms which can be reduced with medications. Option D. They are negative symptoms which cannot be reduced with medications. The correct answer is option Nan. These symptoms are known as positive symptoms, which are most responsive to pharmacological treatment. Negative symptoms include loss of affective responsiveness, verbal expression, personal motivation, enjoyment, social drive or attention to environment, basically a decrease or absence of normal characteristics. Negative symptoms show the least amount of change with pharmacological intervention. Question 36. Neurological. If a patient has a stroke in the left hemisphere, which of the following will be a deficit? Option A, left hemiplegia. Option B, lack of insight and unawareness of deficits. Option C, receptive aphasia, expressive aphasia, or both. Option D, left visual field cut. The correct answer is option Nan. Smith gave A. H. Occupational Therapy and Acute Care, page 186. Question 37. Psychology, which is not true of both oppositional defiant disorder, ODD, and conduct disorder, CD. Option A, referred to as disruptive disorders. Option B, fighting/hostile behavior is common with people who have ODD or CD. Option C, behavior causes significant impairment in social, academic, and/or occupational functioning. Option D results in a high degree of impairment and antisocial behavior. The correct answer is option Nan. Crapia, E.B., Cohn, E.S., Shell, B.A.B., 2003. Willard and Spackman's Occupational Therapy 10th. Question 38. Psychology. Conduct disorder is the more serious of the two disorders and ODD is sometimes a precursor to of conduct disorder. Option A, true. Option B, false. The correct answer is option Nan. Crapia, E.B., Cohn, E.S., Shell, B.A.B., 2003. Willard and Spackman's Occupational Therapy 10th. Question 39. Psychology. What are 3 changes you could make to a living environment to decrease its cognitive demands for patients with dementia? Option A, all of the above. Option B, caregiver programs wristwatch to ring 15 minutes before mealtime, in addition to the alarm. Option C, establish a morning routine supported with physical cues, such as a checklist, and set up a ritual basket on counter. Option D, change environmental context, wallpaper the door to match the walls, to eliminate the. The correct answer is option Nan. Radomski and Latham, PG 758. Question 40. Orthopedic. What is not a proactive contribution for a patient who is recovering from a total hip replacement? Option A, lie on your back while resting in bed with a pillow or foaming between thighs to prevent knees from touching. Option B, sit on soft chairs to allow for greater comfort of the hip while sitting. Option C, get up and move around every hour. Option D, use a raised toilet seat. The correct answer is option Nan. Sitting on soft chairs is actually not recommended due to the fact that a person can sink lower than knee height, they are not firm and straight back, and are harder to transfer in and out of. All of the other answers are proactive suggestions to help a patient recover. Question 41. Management and evidence. According to the evidence, physical environment modifications are most effective for which of the following purposes? Option A. Making community sites more accessible to people with differing abilities. Option B. Home hazard reductions with older adults who have a history of falling. Option C. Worksite modifications to improve productivity or work performance. Option D. Home modifications to prevent injuries in children. The correct answer is option Nan. The most current evidence suggests that with regards to physical environment modifications, home hazard reductions may be most effective with older adults who have a history of falling. There is growing evidence related to home modifications, but much less evidence is available to support environmental modifications in workplace, school, and community environments. Crapia, E.B., Cohn, E.S., and Boitschel, B.A., 2009. Williard and Spackman's Occupational Therapy. Question 42. Management and evidence. A long-term goal for an individual with progressive weakness is for the family to carry out his feeding program. Which statement is the most appropriate short-term goal? Option A. Patient will participate in feeding program. Option B. Patient will feed himself with moderate assistance. Option C. Family will feed patient safely and independently 100% of the time. Option D. Family will demonstrate independence in current positioning and feeding techniques 50% of the time. The correct answer is option Nan. 1. Question 43. Pediatrics. The primary role of an occupational therapist in sensory integration is: Option A. Helping the child learn specific skills. Option B. Helping the child develop one strong sense that will overpower their other senses. Option C. Helping the child learn to reorganize their brain. Option D. Helping the child learn to accept that they are different. The correct answer is option Nan. Specific skill attainment won't aid in integrating one's skills. You want the child's senses to be in balance. A sensory integration disorder most certainly doesn't ostracize a child from their peers. Source: Sensory Integration and the Child by A. Jean Ayres, Ph.D. Question 44. General rehab. Which of the following is not a consideration when working with oncology patients who have bone metastases? Option A. Activity should be pain limited in the patient's AROM. Option B. Avoid manual muscle testing and resistance exercises on the involved extremity. Option C. Patients are always on strict bed rest. Option D. If bone metastasis present in weight-bearing bone, make sure there are orders re weight-bearing status and chart. The correct answer is option Nan. Patients are not always on strict bed rest and should be informed of the risks and benefits of both weight-bearing and bed rest. Question 45. Neurological. When positioning a stroke patient in supine with hemiplegia, what is the correct position? Option A. Place a pillow under the involved scapula and hip. Option B. Place a pillow under the uninvolved scapula and hip. Option C. Place a pillow under the knee of the involved side. Option D. Place a pillow under arm on the uninvolved side. The correct answer is option Nan. Rationale: you place a pillow under the involved scapula and hip to prevent retraction in these areas. You can place an additional pillow alongside the client's involved leg to keep the hip from externally rotating if necessary. Do not place a pillow directly behind the knee as this may contribute to DVT or knee flexion contracture. Source: Willard and Spackman 10th edition PG 605 inch. Question 46. Pediatric, per parental report or therapist observation, a 5-year-old boy fidgets so much that daily routines are interrupted, spins or twirls frequently, and rocks in his chair while performing fine motor tasks. During evaluation, he wants to try all suspended equipment in the room. This most likely points to: Option A. Low threshold vestibular processing. Option B. High threshold tactile processing. Option C. High threshold vestibular processing. Option D. Low threshold auditory processing. The correct answer is option Nan. High threshold vestibular processing. Child needs a higher/greater amount of input to register the sensation, therefore seeks out greater input or constant input. Source: Sensory Profile and Dr. K. Smith notes/book. Question 47. Pediatric. Marissa is a typically developing child who is able to demonstrate true sucking while feeding. How old is Marissa? Option A. 4 months. Option B. 6 months. Option C. 8 months. Option D. 12 months. The correct answer is option Nan. Marissa is able to demonstrate true sucking while feeding, which typically develops around 4 months of age. This indicates that Marissa has reached the developmental milestone of being able to suck effectively during feeding. Question 48. Orthopedic. A 50-year-old patient arrives to your clinic with persistent numbness and tingling in the hypothenar eminence and small finger. The signs and symptoms are exacerbated and radiate proximally at night. The patient is likely suffering from: Option A, compression of the radial nerve at the arcade of Frost. Option B, compression of the ulnar nerve at the cubital tunnel. Option C, compression of the radial nerve at the radial groove. Option D, compression of the median nerve at the carpal tunnel. The correct answer is option B, compression of the ulnar nerve at the cubital tunnel. Answer B, numbness and tingling of the small and ring fingers, hypothenar eminence, and anterior forearm are common signs and symptoms of ulnar nerve compression at the cubital tunnel. Patients who sleep with the elbows bent and hand close to body are likely to experience worsening signs and symptoms at night because of the increased pressure to the cubital tunnel from sustained elbow flexion. Cooper, see Fundamentals of Hand Therapy Clinical Reasoning and Treatment Guidelines for Common Diagnoses of the Upper Extremity, page 232 to 236. Question 49. General Rehab. A 62-year-old widow, who lives alone, is preparing to be discharged from an SNF after 4 weeks of therapy following a hip replacement. The most important equipment the OT should recommend would be: Option A, wheeled walker. Option B, bedside commode. Option C, weighted hairbrush. Option D, long-handled reacher. The correct answer is option Nan. Source: long-handled reachers help patients reach for items without breaking their hip. Precautions: a wheeled walker would be a patient thing. A bedside commode would not be appropriate for someone who is being discharged home, and a weighted hairbrush has nothing to do with hip surgery. Question 50. Neurological. You are completing an evaluation on Mr. Collins, who is a 73-years-old male with a medical history of hypertension, diabetes mellitus type 2, peripheral vascular disease, hyperlipidemia and hyperglycemia. During the evaluation, Mr. Collins reports having blurry vision, complaints of difficulty reading his newspaper, trouble driving at night, and also states that his wife must sort his medications since he can't correctly identify the pills by sight anymore. You further assess Mr. Collins' vision and determine that it is most likely that the patient's visual impairment involves: Option A, diplopia. Option B, visual acuity. Option C, convergence insufficiency. Option D, oculomotor. The correct answer is option Nan. Gutman, S.A. and Schoenfeld, A.B., 2009. Screening Adult Neurologic Populations. 2nd ed., Bethesda, Maryland, American Occupational Therapy Association Incorporated, p. 51. Question 51. Pediatrics. What is the correct sequence for the development of play? Option A, symbolic play, exploratory play, creative play, games. Option B, exploratory play, creative play, symbolic play, games. Option C, exploratory play, symbolic play, creative play, games. Option D, creative play, symbolic play, exploratory play, games. The correct answer is option Nan. Exploratory play happens from 0 to 2 years, symbolic play 2 to 4 years, creative play 4 to 7 years, and games with rules and directions 7 to 12 years. ENCOT Review and Study Guide, PG 95-inch. Question 52. Pediatrics. What is the correct sequence for the development of play? Option A, symbolic play, exploratory play, creative play, games. Option B, exploratory play, creative play, symbolic play, games. Option C, exploratory play, symbolic play, creative play, games. Option D, creative play, symbolic play, exploratory play, games. The correct answer is option C, exploratory play, symbolic play, creative play, games. Answer: C. Exploratory play happens from 0 to 2 years, symbolic play 2 to 4 years, creative play 4 to 7 years, and games with rules and directions 7 to 12 years. ENCOT Review and Study Guide, PG 95-inch. Question 53. Neurological. An OT is providing intervention for a client who had a stroke involving Broca's region in the left hemisphere. This client would have difficulty with: Option A, expression. Option B, receptive language. Option C, both expressive and receptive language. Option D, a rapid speech pattern. The correct answer is option Nan. A, expression. Clients with Broca's aphasia have slowed labored speech with some apraxia also noted, but they have good receptive language skills unless it is too rapid or lengthy. Pedretti L., Early MB, Occupational Therapy, Practice Skills for Physical Dysfunction, ed. 5, St. Louis, 2001, Mosby. Found in the Q&A for the Occupational Therapy Board Examination by Patricia Boyer and Dorothy Bethia, 2007. Question 54. General rehab. Which of the following is the least important thing to do before seeing a patient in acute care? Option A, check to see if the patient is awake. Option B, do a thorough chart review. Option C, check all of the orders and verify that there is an activity order from the doctor. If not, page the. Option D, tell the nurse that you are from OT and are checking to see if you can see the patient and. The correct answer is option B, do a thorough chart review. It is not very important to see if the patient is awake or not. In most cases, you will wake the patient up to participate in therapy anyway. Question 55. General rehab, a unique therapy goal to address in a morning ADL with a patient following a recent below-the-knee amputations is: Option A, lower body dressing. Option B, residual limb care using a long-handled mirror. Option C, item retrieval with a front-wheeled walker. Option D, upper extremity exercise program. The correct answer is option Nan. Care following a recent amputation includes instructing patients on proper limb hygiene, Radomski and Trombley-Latham, 2008. Lower body dressing is typically addressed in most patients' morning ADL, however limb care is unique to patients with recent amputations. Question 56. Neurological, when working with a patient who was recently involved in a MVA, you notice that he is unable to wrinkle his forehead and has difficulty closing his eyes completely. Which cranial nerve has likely been damaged? Option A, trigeminal. Option B, facial. Option C, trochlear. Option D, vagus. The correct answer is option Nan. The patient's inability to wrinkle his forehead and difficulty closing his eyes completely suggests damage to the facial nerve. The facial nerve controls the muscles of facial expression, including the forehead and eyelid muscles. Damage to this nerve can result from trauma, such as a motor vehicle accident. The other cranial nerves listed do not innervate the muscles involved in these specific actions, making them less likely to be damaged in this scenario. Question 57. Neurological, an OT is providing intervention for a client who had a stroke involving Broca's region in the left hemisphere. This client would have difficulty with: Option A, expression. Option B, receptive language. Option C, both expressive and receptive language. Option D, a rapid speech pattern. The correct answer is option A, expression. Answer A, expression. Clients with Broca's aphasia have slowed labored speech with some apraxia also noted, but they have good receptive language skills unless it is too rapid or lengthy. Pedretti L., Early MB, Occupational Therapy, Practice Skills for Physical Dysfunction, ed. 5, St. Louis, 2001, Mosby. Found in the Q&A for the Occupational Therapy Board Examination by Patricia Bowyer and Dorothy Bethia, 2007. Question 58. Orthopedic, after a total hip replacement, posterolateral approach, a patient is permitted to do which of the following? Option A, rotate the operated leg inward. Option B, rotate the operated leg outward. Option C, bend at the waist/hips more than 90 degrees. Option D, cross the operated leg past the midline of the body. The correct answer is option Nan. B is the correct answer. Positions of instability include adduction, internal rotation, and flexion. While external rotation is allowed for the posterolateral approach, it is not permitted for patients who have had an anterolateral approach. Pendleton, H. M., and Schultzkron, W., eds. 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction. St. Louis, Missouri, Mosby Elsevier, pages 1024. Question 59. Pediatrics, you are evaluating an infant in an outpatient clinic for feeding problems. What is the first step in the evaluation process? Option A, discussing information about the child's medical history. Option B, evaluating the child for clinical signs of underlying disorders. Option C, assessing the developmental and neuromotor status of the infant. Option D, asking parents and caregivers questions about feeding, eating, and swallowing. The correct answer is option Nan. Schuberth, L.M., Amaralt, L.M., and K. Smith, J., 2010, Feeding Intervention, in J. Case. Question 60. Neurological, cubital tunnel syndrome involves compression of the following. Option A, the median nerve in between the two heads of pronator teres. Option B, the ulnar nerve at the elbow. Option C, the median nerve at the wrist. Option D, the radial nerve at the elbow. The correct answer is option Nan. Cubital tunnel syndrome is the second most common nerve compression syndrome involving pressure at the elbow. Symptoms include numbness and tingling along the ulnar aspect of the forearm and hand. National Occupational Therapy Certification Exam, Review and Study Guide, 5th ed., 2009, p. 134-inch. Question 61. Orthopedic, you are working with a client with an elbow disarticulation amputation. What loss of function can you expect to see with this injury? Option A, hand and wrist function, about 50% of pronation and supination. Option B, hand and wrist function, all pronation and supination, elbow flexion and extension. Option C, loss of all arm and hand functions, partial or complete loss of clavicle and scapula. Option D, some or all grip functions. The correct answer is option Nan. Keenan, D., Glover, J., 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction, 6th edition. PG 1103, Table 43 to 1 amputation levels, functional losses, and suggested prosthetic components. Question 62. Which treatment approach for neurobehavioral deficits is characterized by focusing on specific deficits from the bottom up, assuming that improving individual component performance will lead to enhanced overall skill? Option A, compensatory and adaptive approach. Option B, restorative and remedial approach. Option C, combination approach. The correct answer is option Nan. The restorative and remedial approach to treatment for neurobehavioral deficits involves targeting specific deficits from the bottom up. This means that therapy focuses on addressing underlying impairments or components of function, with the assumption that improving these individual components will ultimately lead to enhanced overall skill and function. Question 63. Neurological. With the patient's eyes closed, you place your patient's arm with shoulder abducted, elbow flexed at 90 degrees, and palm facing out. The patient is asked to indicate if the elbow is flexed or extended and states it is extended. What sensory deficit is your patient experiencing? Option A, kinesthesia. Option B, proprioception. Option C, stereognosis. Option D, tactile localization. The correct answer is option Nan. Pendleton, H. M., and Schultzkrohn, W., eds. 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction. St. Louis, Missouri, Mosby Elsevier, 520. Question 64. General rehab, which is not precaution for patient in several weeks after having implanted pacemaker. Option A, not to lift more than 5 pounds. Option B, not raise the affected arm over your shoulder. Option C, not pull or push. Option D, not bend hip more than 90 degree. The correct answer is option Nan. Source: http://www.webmd.com/heart-disease/pacemaker-placement. Question 65. Neurological. A patient with a lesion in the cerebellum may present with all of the following symptoms except: Option A, ataxic movement. Option B, balance/equilibrium problems. Option C, apraxia. Option D, decreased coordination, gross and fine. The correct answer is option A, ataxic movement. A, B, and D are all signs or symptoms that may present with a lesion in the cerebellum. Screening the adult neurologic population, page 112. C. Apraxia is oftentimes seen in a person whom has a lesion in the frontal lobe. Screening the adult neurologic population, page 148. Question 66. Neurological. This diagnosis is characterized by rapidly progressing polyneuropathy with symmetric muscle weakening and distal sensory loss. The etiology is unknown, however may occur after an infectious disorder, surgery, or immunization. Option A, myasthenia gravis. Option B, multiple sclerosis. Option C, Guillain-Barré syndrome. Option D, ALS. The correct answer is option Nan. Fleming-Castaldi, R. National Occupational Therapy Certification Exam, 5th edition, 165-168. Question 67. Neurological. You are treating a client who has sustained a CVA and presents with impaired right UE motor control. When grading your treatment, what functional task would be the most challenging for the client to work towards? Option A, supporting upper body weight with the affected arm while wiping crumbs from the table from the unaffected arm. Option B, ironing clothes with the affected arm. Option C, opening and closing drawers with the affected arm. Option D, removing dishes from a cabinet with the affected arm. The correct answer is option Nan. Weight bearing, A, and supported reach, B and C, activities help establish the motor control, motor pattern, and strength needed to support higher levels of functional UE such as reaching in space. D. Pendleton, H. M. and Schultzkrohn, W. 2006. Pedretti's Occupational Therapy Practice Skills for Physical Dysfunction, 6th edition, St. Louis, M. O. Mosby Elsevier. Question 68. Neurological. The goal for a patient who has had a CVA is to be able to put on a shirt independently. The most effective way to structure dressing training for maximum learning retention and generalization of this skill is: Option A, teaching and practicing each segment of the dressing procedure during consecutive treatment sessions. Option B, practicing the whole task of putting on a shirt in a setting similar to the real environment. Option C, providing dressing simulation activities. Option D, allowing the client to view a videotape on how to put on a shirt and written directions for completing the. The correct answer is option Nan. Johnson, C., Lorch, A., DeAngelis, T., 2001. The Occupational Therapy Examination Review Guide, 2nd edition, PG 118. Question 69. Pediatric. A child has sensory processing issues, specifically in body awareness and modulation affecting attention and ability to transition throughout the day. Which of the following is not an appropriate intervention for this child? Option A, single-point platform swinging. Option B, jumping on a trampoline. Option C, free play/running in the gym class. Option D, joint compression/deep pressure massage. The correct answer is option C, free play/running in the gym class. Free play/running with peers in an open gymnasium will be too overstimulating for a child with these issues. It will be difficult for them to keep their body under control or focus on what is going on. The child will probably become too overstimulated or shut down. Swinging, jumping, and joint compression/massage are good activities to help provide regulation and body awareness. Question 70. General rehab. Caution must be taken when considering the use of electrical stimulation with which of the following patients? Option A, a patient with cancer. Option B, a patient with severe arthritis. Option C, a patient taking medication for high blood pressure. Option D, a patient with a broken bone. The correct answer is option C, a patient taking medication for high blood pressure. Electrical stimulation should not be applied directly over or in proximity to active cancer. There are no warnings or contraindications for e-stim related to arthritis, B, or broken bones, D. Answer C is the distractor, as patients with uncontrolled high blood pressure should not receive electrical stimulation, but those on medication to regulate hypertension are safe to receive this treatment. Question 71. Orthopedic. After a fracture to the proximal 2/3 of humerus, what is a common secondary diagnosis that can decrease a patient's grip strength? Option A, tear to the insertion of the deltoid. Option B, sprain of the ulnar collateral ligament. Option C, radial nerve palsy. Option D, brachialis tear. The correct answer is option Nan. Radial palsy is the most common secondary diagnosis from humeral fractures. Radial palsy can cause weakness of the extensor muscles of the hand. With weak extensor muscles, patients cannot perform full wrist tenodesis, which maximizes grip strength. Cooper, see Fundamentals of Hand Therapy, Clinical Reasoning and Treatment Guidelines for Common Diagnoses of the Upper Extremity, page 216 to 219. Question 72. Management and evidence. When using the Rancho Los Amigos scale to assess a patient who has sustained a TBI who presents with a heightened level of response, severely confused, and may be aggressive, reflects what level of cognitive function? Option A 2, Option B 3, Option C 4, Option D V. The correct answer is option Nan. C, for cognitive, confused, agitated. A. Question 73. Orthopedic. What is the function of the flexor digitorum superficialis, FDS? Option A, flexion of pip joints. Option B, flexion of dip joints to digits 2 and 3. Option C, flexion of IP joints of thumb. Option D, flexion of dip joints to digits 4 and V. The correct answer is option Nan. Flexor digitorum superficialis flexes the pip joint source, PG 126 study guide. Question 74. Management and evidence. Constraint-induced therapy, CIT, is designed to promote increased use of a weak or paralyzed arm and has been credited with speeding up the cortical map reorganization process in non-human primates and in humans. CIT is based on a combination of two theories, including the dynamic systems theory and the task-oriented approach to motor control acquisition. What is true about the dynamic systems theory? Option A, dynamic systems theory is based on a hierarchical model. Option B, NDT and PNF are derived from the dynamic systems theory. Option C, dynamic systems theory describes motor behavior as a dynamic interaction between client factors. Option D, dynamic systems theory is without a doubt the only approach that works in modern healthcare. The correct answer is option Nan. Pendleton, H. M., and Schultzkrohn, W., eds. 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction. St. Louis, Missouri, Mosby Elsevier, 792 to 793. Question 75. Neurological. You get a referral to evaluate an individual's executive functioning following a mild CVA. What are you most likely to assess? Option A, orientation, attention, memory. Option B, job interests. Option C, initiation and planning. Option D, spatial relations. The correct answer is option Nan. Following a mild CVA, cerebrovascular accident, executive functioning is commonly affected. Executive functioning refers to the cognitive processes involved in goal-directed behavior, including initiation and planning. Therefore, when evaluating an individual's executive functioning after a mild CVA, the most likely assessment would be initiation and planning. Orientation, attention, and memory may also be assessed, but they are not specifically related to executive functioning in this context. Job interests and spatial relations are not directly related to evaluating executive functioning after a mild CVA. Question 76. General rehab. Problems in cognitive functioning can be part of both MS and fibromyalgia. Which of the following is not a compensatory strategy you would make to patients with either diagnosis for improving cognitive function? Option A, checklists. Option B, alarm reminders. Option C, pen and paper exercises. Option D, PDAs. The correct answer is option C, pen and paper exercises. Because pen and paper cognitive exercises are considered a remediation strategy, not a compensatory strategy. Question 77. Pediatric. An 8-year-old girl is referred secondary to poor handwriting and the OT notices general low muscle tone during evaluation. This is particularly noticeable in the hands due to the decreased prominence and visibility of the knuckles. What activities would be most appropriate to focus on as you begin therapy with this child with a goal of improved handwriting? Option A, handwriting tasks at a table/desk. Option B, finding marbles and therapy putty. Option C, finding the right pencil grip. Option D, handwriting on a slanted or vertical surface. The correct answer is option Nan. Without the necessary hand strength, the child may not be able to develop the appropriate grip, intrinsic movements, or endurance for handwriting at the first or second grade level. Practicing handwriting without improving the underlying skills may lead to future bad habits and poor skills. Source: Dr. K. Smith Class Notes/book. Question 78. General rehab. Which of the following would be appropriate for an older adult who was recently admitted to a SNF following a recent exacerbation of CHF? Option A, monitor the individual's vital signs, BP, pulse, O2 saturation, during treatment sessions. Option B, conduct all treatment sessions bedside and have patient remain supine throughout. Option C, grade self-care activities to improve activity tolerance. Option D, answers A and C. The correct answer is option Nan. Reference: Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction, 6th edition, pg 1143, 1146. Question 79. Neurological. You are assessing a traumatic brain injury patient and note that the patient is very agitated, moving around in his bed almost non-stop, requiring restraints at times. The patient is also very confused and follows very few one-step commands. According to the Rancho Los Amigos Levels of Cognitive Function Scale, your patient is at Option A, Level 2, Option B, Level 3, Option C, Level 4, Option D, Level V. The correct answer is Option C, Level 4. Rationale: C is the correct answer because according to the Rancho scale, Level 4 is confused, agitated. Agitation is the key in this answer. Level 2 and 3 are less responsive and only responding to certain stimuli. By Level V, the agitation has subsided, but the confusion remains. Source: Occupational Therapy for Physical Dysfunction, 6th edition, Radomski and Latham, p. 1048 inch. Question 80. Psychology. All of the following are examples of psychosocial approaches to working with clients diagnosed with Parkinson's disease except Option A, group approach promoting exercise and teaching groups to improve mood and socialization. Option B, encourage continuation of productive activities and leisure with suitable challenges. Option C, educate the family to understand how the social interaction is affected by PD, such as facial masking and oral rigidity. Option D, encourage the client to increase voice volume through speaking and singing activities. The correct answer is option Nan. Willard and Spackman's Occupational Therapy 11th ed. Question 81. Neurological. OTs oftentimes evaluate muscle spasticity. What does muscle spasticity not include? Option A, changes in response to stretch. Option B, inability to rapidly turn off muscles. Option C, increased ability to produce appropriate force for a specific task. Option D, changes in the intrinsic properties of muscle fibers. The correct answer is option Nan. Spasticity includes changes in response to stretch, decreased ability to produce appropriate force for a specific task, increased latency of activation, inability to rapidly turn off muscles, loss of reciprocal inhibition between spastic muscles and their antagonists, changes in the intrinsic properties of muscle fibers, and inability to generate enough antagonist power to overcome spastic muscles. Neurological Rehabilitation 5th edition. Umfred, 2007, pg 545 inch. Question 82. General rehab, which is not an intervention for a person with cancer. Option A, restoring performance skills and patterns. Option B, preventing disability. Option C, wheelchair seating and positioning. Option D, modality, diathermy. The correct answer is option Nan. Diathermy is contraindication of active cancer source. Occupational therapy for physical dysfunction. M.V. Radomski and C.A. T. Latham P. 819 http://www.rehabpub.com/issues/article/2008-01_05.asp. Question 83. General rehab. When educating a patient on proper breathing techniques who has recently been diagnosed with COPD, an occupational therapist should tell the patient to inhale through the nose as if smelling roses and to exhale through the mouth. Option A. As if blowing forcibly to relight a dying campfire. Option B. In quick, short, multiple breaths. Option C. As if blowing out 20 lit birthday cakes. Option D. As if flickering a lit candle. The correct answer is option D. As if flickering a lit candle. Answer D. This is called pursed lip breathing. It increases the use of the diaphragm and decreases accessory muscle recruitment. They should inhale deeply through the nose and exhale through their mouths with pursed lips, as if they are whistling. Their exhales should take twice as long as their inhales, and some resistance from their lips in the exhale should be felt. Occupational Therapy, Practice Skills for Physical Dysfunction, 6th edition, pg 1151 inch. Question 84. General rehab. Why is it important not to turn up the oxygen on a person who is a CO2 retainer, even if their oxygen statistics have dropped? Option A. More oxygen will produce more CO2. Option B. It will cause their oxygen to increase too much. Option C. Turning up the oxygen will make the patient dependent on oxygen. Option D. Increasing the oxygen will slow the rate of breathing, slowing the rate they get rid of excess CO2. The correct answer is option N. If a patient has a chronically low levels of oxygen and high levels of CO2, breathing high levels of oxygen can cause a person to slow down their breathing because the peripheral chemoreceptors are being signaled to do so. Since a person's breathing is how they blow off excess CO2, you can see how this could be detrimental to a person who already has a high CO2 level. Source: http://respiratorytherapycave.blogspot.com/2008/06/hypoxic-drive-theory.html. Question 85. Pediatric. You are an OT in an early intervention toddler classroom where most of your clients are 2 to 3 years old. Which kind of play do you expect to be predominate between these children? Option A. Imaginary. Option B. Associative. Option C. Parallel. Option D. Social. The correct answer is option C. Parallel. Answer C. Preschoolers from 24 to 36 MO predominantly have parallel play skills with emerging associative social play as they begin to play with one another. Source: K. Smith, J. 2005. Occupational Therapy for Children, 5th edition, St. Louis, Missouri, Elsevier Incorporated. Question 86. Orthopedic. A 38-year-old woman was referred to therapy for lateral epicondylitis of her right dominant UE with a positive Cousins test. During the acute phase of treatment, session should focus on all but Option A. Reducing pain. Option B. Splinting. Option C. AROM. Option D. Strengthening. The correct answer is option D. Strengthening. Answer D. Strengthening occurs more during the restorative phase once pain is improved. Source: Fundamentals of Hand Therapy, Cynthia Cooper, pg 290. Question 87. Pediatric. You are evaluating the fine motor skills of preschoolers at age 3 to see if they qualify in motor for special education services. You will evaluate the children's fine motor skills and your patient colleague will use the same assessment to evaluate the children's gross motor skills. Which standardized assessment is most appropriate to use? Option A. PEDI. Option B. SFA. Option C. Peabody. Option D. BOT2. The correct answer is option C. Peabody. Answer C. The PEDI is not specific to fine and gross motor and is mostly parent interview. The SFA is for ages K6. The BOT2 has fine and gross motor scores but is for ages 4.5 to 14.5. The Peabody is the best choice because it has a fine and gross motor scale and ranges from ages 1 to 84 months. Source: K. Smith, J. 2005. Occupational Therapy for Children, 5th edition, St. Louis, Missouri, Elsevier Incorporated. Question 88. Psychology. You are seeing a new patient with a history of depression, hypertension, anxiety, schizophrenia, and coronary artery disease. During your initial evaluation you notice that he constantly appears to be licking his lips and sticking his tongue out. Later, as you're writing up his evaluation, you realize the athetoid and rhythmic-like movement of his tongue is Option A. Tardive dyskinesia, a side effect of Zoloft, his antidepressant medication. Option B. Tardive dyskinesia, a typical positive symptom of schizophrenia and the patient can't help it. Option C. Tardive dyskinesia, a side effect of aripiprazole, his antipsychotic medication. Option D. Tardive dyskinesia, a typical symptom of high anxiety. The correct answer is option Nan. Cara, Elizabeth and McCrae, and 2005. Psychosocial Occupational Therapy, a Clinical Practice. 2nd ed., Clifton Park, New York, Delmar, Signage Learning, p.714-717. Question 89. Neurological, true or false, retention of primitive reflexes is less likely in children with hypotonia than those with hypertonia. Option A, true. Option B, false. The correct answer is option A, true. Answer A, true. Children with hypertonia are more likely to retain primitive reflexes. However, delays in the development of postural reactions are a major concern for children with hypotonicity. Neurological Rehabilitation 5th edition. Umfred, 2007. pg 399 inch. Question 90. Orthopedic, which of the following actions does not violate precautions during the first 6 weeks following lumbar spine surgery? Option A, checking the car's blind spot while driving. Option B, lifting a 2-year-old child out of the swing at the playground. Option C, reaching down to tie one's shoes. Option D, sitting with your hips above your knees and feet planted on the floor. The correct answer is option D, sitting with your hips above your knees and feet planted on the floor. Typical precautions following lumbar spine surgery include no twisting, no lifting greater than 10 pounds, and no bending. Answers A, B and C violate these rules. Answer D represents an appropriate way to sit in a chair to maintain good body mechanics following spine surgery. Question 91. Pediatrics, you are working with a 4-year-old student referred to OT to develop handwriting skills. Which of the following performance tasks would be appropriate for this age group? Option A, imitating horizontal, vertical, and circular lines. Option B, copying vertical and horizontal lines. Option C, copying cross, diagonal line, square, and beginning letters of name. Option D, printing all 26 letters and numbers, 0 to 9. The correct answer is option C, copying cross, diagonal line, square, and beginning letters of name. These are appropriate characters for a 4-year-old to print at this stage in handwriting development. Choice A, appropriate for 2-year-olds. Choice B, appropriate for 3-year-olds. Choice D, appropriate for 6+ years. Occupational Therapy for Children, Case Smith, page 588. Question 92. General rehab. When working with a cardiac care patient in the hospital, it is important to educate the patient on Option A, energy conservation/work simplification. Option B, upper body strengthening. Option C, lifestyle changes. Option D, A and C. The correct answer is option Nan. In the acute care setting, it is crucial to educate cardiac patients on to ensure safe daily activity and long-term heart health. Post-cardiac event due to sternal precautions and recovery needs. Early education helps patients understand expectations before returning home. Question 93. General rehab. To facilitate increasing independence in lower body dressing in a patient with a TL spine precautions and wearing a TLSO, which intervention is contraindicated? Option A, provide the patient with a reacher. Option B, teach effective bed mobility techniques to assist in rolling. Option C, use leg straps to help pull legs into a circle sit. Option D, instruct the patient to raise the head of the bed 50 degrees so they can reach their feet prior to. The correct answer is option B, teach effective bed mobility techniques to assist in rolling. If a patient has TL spine precautions, they need to wear their TLSO whenever they are out of bed or the head of bed is raised higher than 30 degrees. Question 94. Orthopedic. Range of motion to the hand of a tetraplegia patient is performed in a specific way to facilitate tenodesi's grasp. Which is correct? Option A, passive opening of the fingers when the wrist is flexed and closing of the fingers when the wrist is extended. Option B, passive closing of the fingers when the wrist is flexed and opening of the fingers when the wrist is extended. Option C, passive closing of the fingers when the wrist is flexed and closing of the fingers then the wrist is extended. The correct answer is option A, passive opening of the fingers when the wrist is flexed and closing of the fingers when the wrist is extended. To promote and facilitate tenodesi's grasp, passive opening of the fingers and extension and closing of the fingers when extended. Question 95. General rehab. You suspect your client may have a visual field cut and would like to conduct a gross screen to find out. Which of the following are examples of screens for visual field deficits that could be used in addition to careful observation during ADL task? Option A and B. Option B. You ask the patient to follow the tip of your pen with their eyes as you glide the pen through. Option C, kinetic test. Examiner stands behind the patient and moves a target in from the periphery while the patient fixates on. Option D, static confrontation test. Examiner sits in front of patient and has patient fixate on a centrally placed object examiner holds. The correct answer is option A and B. And B, but remember, These are only gross screens. Standardized versions of these tests are included in the BIVABA Brain Injury Visual Assessment Battery for Adults, reference, Pedretti, O.T., Practice Skills for Physical Dysfunction 5th edition, page 404. Question 96. Pediatrics, an occupational therapist is evaluating a 12-month-old child due to concerns with self-feeding. What skills should the therapist be looking for to determine if the child's current performance is developmentally appropriate? Option A, holds table food but sucks on it rather than biting. Option B, scoops food with spoon and brings it to mouth. Option C, utilizes raking grasp to finger feed. Option D, spoon feeds with some inversion and spilling. The correct answer is option Nan. Case Smith, O'Brien, Occupational Therapy for Children, 2010 pg 453. Question 97. Pediatrics, an OT is working with a child that is suspected of having difficulties with visual perceptual skill. Developmentally, the first visual component that needs to be assessed is option A, pattern recognition, option B, scanning skills, option C, visual attention, option D, oculomotor control. The correct answer is option Nan. D. Oculomotor control, visual field and visual acuity are considered to be primary visual skills and serve as the foundation as hierarchy of visual perceptual skills. Mosby's Q&A review for the Occupational Therapy Board examination. Patricia Bowyer ed author/LBCN, author, Dorothy P. Bethia ed MPARL, author. Question 98. Pediatrics, an occupational therapist is evaluating a 12-month-old child due to concerns with self-feeding. What skills should the therapist be looking for to determine if the child's current performance is developmentally appropriate? Option A, holds table food but sucks on it rather than biting. Option B, scoops food with spoon and brings it to mouth. Option C, utilizes raking grasp to finger feed. Option D, spoon feeds with some inversion and spilling. The correct answer is option Nan. Case Smith, O'Brien, Occupational Therapy for Children, 2010 pg 453. Question 99. Pediatrics, an OT is working with a child that is suspected of having difficulties with visual perceptual skill. Developmentally, the first visual component that needs to be assessed is option A, pattern recognition, option B, scanning skills, option C, visual attention, option D, oculomotor control. The correct answer is option D, oculomotor control. Answer D. Oculomotor control, visual field and visual acuity are considered to be primary visual skills and serve as the foundation as hierarchy of visual perceptual skills. Mosby's Q&A review for the Occupational Therapy Board examination. Patricia Bowyer ed author/LBCN, author, Dorothy P. Bethia ed MPARL, author. Question 100. Pediatrics, you are a brand new, on-the-job pediatric occupational therapist. Your first intake has arrived and you are set to evaluate your very first child as a real pediatric OT. This little boy has just turned 4. He craves deep pressure, is very active, and has no sense of fear. He cannot ride a bike, tends to be clumsy, and has fine motor deficits, i.e. cannot hold a pencil correctly and cannot stay within the lines when coloring. What assessments would you use that would give you the exact information you needed while being the most concise? Option A, Peabody Development of Motor Scales, Sensory Profile, and Clinical Observation. Option B, Bailey Scales of Infant Development and Clinical Observation. Option C, Bruinank-Sauceresky, Bot 2, and Sensory Profile. Option D, Sensory Profile and Clinical Observation. The correct answer is option Nan. Actual intake from week of 11/15, assessment confirmation made by Darcy Scheffler, author/L. Question 101. Pediatric, a child with CP scores in the 10 percentile for her age on the Berry VMI. To determine her visual perceptual abilities, your next step would be option A, complete the Bot 2, option B, ask her to complete a maze, option C, ask her to construct the same shape that you build out of blocks, option D, complete the visual subtest of the VMI. The correct answer is option D, complete the visual subtest of the VMI. Answer D, completing the visual subtest will remove from the results any influence of physical disability secondary to CP and will allow you to examine her visual perception. Source, Dr. Kirsty Nelson Class Notes, VMI Examiner's Manual. Question 102. Neurologic, what is the most common brain tumor? Option A, glioblastoma. Option B, anaplastic. Option C, astrocytoma. The correct answer is option Nan. Astrocytoma is the most common brain tumor. This type of tumor originates from astrocytes, which are star-shaped cells that support and nourish nerve cells in the brain. Astrocytomas can be classified into different grades, ranging from low-grade, less aggressive, to high-grade, more aggressive. However, overall, astrocytoma is the most frequently diagnosed brain tumor. Question 103. Orthopedic, a patient presents to your outpatient facility several weeks after a recent 2-digit compression fracture. Surgery was completed and several pins were placed in the finger to provide stability. The digit is noticeably swollen and lacks both passive and active range of motion. Upon evaluation, you find that his grip and pinch strength are much lower than those in his non-affected hand and that he is unable to make a full fist. What would be your first priority with this patient? Option A, providing resistive strengthening exercises to increase grip strength. Option B, providing manual therapy to stretch the shortened muscle fibers and increase ROM. Option C, providing ultrasound to the affected digit to decrease pain. Option D, providing the patient with a compression garment and strategies to reduce edema at home. The correct answer is option N. Rationale, according to a clinical Pearl in Cooper's book, reducing edema is almost always the first priority. Do this and the client will gain motion. A digit that is extremely swollen will not tolerate stretch to be placed upon it the way that a non-swollen digit would. With edema in the way, the finger will be stiff and unable to bend. Once the edema is gone, the patient will gain the ability to bend, and then focusing upon increasing ROM and strength will be appropriate. Also, it is important to use modalities that are appropriate for the client. Using ultrasound on an individual with pins could be detrimental, as the deep heat could increase the temperature of the metal pins and burn internal tissues. Reference: Fundamentals of Hand Therapy, Clinical Reasoning and Treatment Guidelines for Common Diagnoses of the Upper Extremity, 2007, edited by Cynthia Cooper. Question 104. General Rehab. A person who is unable to maintain focus as an object moves closer and further away is having difficulty with what visual skill? Option A, accommodation. Option B, saccades. Option C, convergence. Option D, smooth pursuits. The correct answer is option N. C is the correct answer. Accommodation is the ability of the eye to adjust focus at different distances, while convergence is the ability of the eye to maintain focus as an object moves closer and further away. Saccades are quick eye movements that change fixation from one point to another and allow a person to redirect his or her line of sight. Smooth pursuits are eye movements that maintain continued fixation on a moving target. Radomski and Latham, 2008, Occupational Therapy for Physical Dysfunction, 6th edition, Baltimore MD. Lippincott, Williams and Wilkins. Pages 241. Question 105. Pediatrics. When working with children with Down syndrome, an appropriate activity to work on with a child who is between 2 and 4 years of age is: Option A, introducing printing activities using special lined paper. Option B, encouraging your child to hold a fork with a mature grasp. Option C, provide simple matching, dot-to-dot activities. Option D, provide toys that fit into holes and spaces, space sorters. The correct answer is option N. The previous activities are for older aged children, and could be beyond the child's skill level. Resource: Fine Motor Skills in Children with Down Syndrome. A Guide for Parents and Professionals. Marianne Bruni, BSc C. Question 106. Neurological. There are several complications that can occur after a stroke, including all of the following except: Option A, apraxia. Option B, depression. Option C, shoulder pain/subluxation. Option D, anxiety. The correct answer is option N. Anxiety is not a noted common occurrence after a stroke, however depression, shoulder subluxation and apraxia are very common. Source: RNL Physical Function Book. Question 107. General Rehab. When evaluating a client for a wheelchair, you determine they are appropriate for a regular/adult wheelchair. The dimensions of the chair will be blank inches wide by blank inches deep by blank inches high, and the correct hip angle is blank, knee angle is blank and ankle angle is blank. Option A, 18x 18x 20 and 90, 80, 90. Option B, 18x 16x 20 and 90, 90, 90. Option C, 18x 20x 16 and 90, 90, 90. Option D, 18x 16x 20 and 80, 80, 120. The correct answer is option N. 18 inches wide, 16 inches deep, and 20 inches high, with the hips at 90, the knees at 90 and the ankles at 90. Question 108. Pediatrics. How does a typical child with a brachial plexus injury present when entering an OT clinic for an evaluation? Option A, shoulder internally rotated and depressed with a straight elbow, and the wrist rotated outward. Option B, shoulder hiking and internal rotation, flexed elbow, and flexed wrist. Option C, shoulder external rotation, extended elbow, extended wrist. Option D, shoulder in neutral, elbow flexion, wrist in neutral. The correct answer is option N. The child often presents as if their arm is hanging out of the socket in a straight manner, with the wrist turned laterally. Source: http://www.cincinnatichildrens.org/svc/alpha/b/brachial-plexus/health/brachial-plexus.hdm. Question 109. General rehab. An individual with MS is independent with bathtub transfers using a grab bar. The most important self-care recommendation the OT practitioner can make regarding bathing is to: Option A. Use cool water. Option B. Use moderately heated water. Option C. Take showers and avoid bathing. Option D. Bathe at the sink with a basin. The correct answer is option B. Use moderately heated water. Correct answer is B. Hot water may contribute to fatigue in individuals with MS, and therefore should be avoided. Moderate water temperature is recommended. Bathing in cool water is unnecessary and may cause chilling and increase spasticity. Bathing rather than showering is recommended for individuals with poor balance or standing tolerance such as those with MS or COPD. Bathing at the sink may be recommended for individuals who experience difficulty bending such as those with hip or knee replacements or back pain. However, durable medical equipment is typically available for all these diagnoses and a tub bench and handheld shower could be recommended. Radom-Ski and Trombley, Occupational Therapy for Physical Dysfunction, 6th edition Chapter 40, Neurodegenerative Diseases. Question 110. Neurological. What is the most common brain tumor? Option A. Glioblastoma. Option B. Anaplastic. Option C. Astrocytoma. The correct answer is option NAN. Umfred's Neurological Rehabilitation, PGS. 813, 815. Question 111. Neurological. After experiencing a TBI, your patient is found lying on the ground demonstrating decorticate rigidity as a result of damage to the cerebral hemispheres causing interruption in the corticospinal tracts that transmit voluntary motor messages to all extremities. How would the UE and LA present in this situation? Option A. UEs equals flexed, internally rotated, and adducted. LEs equals extended, internally rotated, and adducted. Option B. UEs equals extended, internally rotated, and abducted. LEs equals extended, internally rotated, and adducted. Option C. UEs equals extended, internally rotated, and adducted. LEs equals extended, internally rotated, and adducted. Option D. UEs equals flexed, externally rotated, and adducted. LEs equals extended, internally rotated, and adducted. The correct answer is option NAN. Pendleton, H. M., and Schultzkrohn, W., eds. 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction. St. Louis, Missouri. Mosby Elsevier. 845-847. Question 112. Neurological. An individual with a traumatic brain injury is impulsive during self-feeding, which is exemplified by placing too much food in his mouth at one time. What method would most effectively develop safer eating habits? Option A. Cut the food into smaller pieces. Option B. Have the individual count to 10 between bites of food. Option C. Have the individual set down the utensil until the mouth is cleared. Option D. Serve the food in separate containers on the meal tray. The correct answer is option C. Have the individual set down the utensil until the mouth is cleared. Correct answer is C. Having the individual learn to set down the utensil until the mouth is cleared is a method of imposing a restriction on the behavior which can then develop into an established routine to pace himself during feeding. Cutting the food into smaller pieces and placing the food into separate containers are examples of environmental adaptations, not habit development. An impulsive person who eats too fast also will have difficulty counting slowly enough to have his mouth cleared in time to the count of 10 is reached. C is the best answer for behavioral modification. Radom-Ski and Trombley, Occupational Therapy for Physical Dysfunction, 6th edition Chapter 29, Optimizing Cognitive Abilities. Question 113. General rehab. A patient who had a myocardial infarction 2 days ago is beginning phase 1 of cardiac rehabilitation. Which of the following actions is essential for the OT to do during the patient's initial session? Option A. Provide instruction on stress management. Option B. Monitor the client's orthostatic tolerance. Option C. Initiate reconditioning and isometric activities. Option D. Teach the client to measure energy expenditure. The correct answer is option B. Monitor the client's orthostatic tolerance. Answer B. References: the NCOT Official OT Study Guide, PG 46, Radom-Ski and Latham, Occupational Therapy for Physical Dysfunction, 6th edition. Pages 1302 to 1303. Question 114. Neurological. A 90-year-old woman suffered a right CVA and will be receiving therapy in a SNF. Upon evaluation, the OT determines that left shoulder is subluxed. The most appropriate approach for treating the subluxed shoulder is: Option A. Wear a shoulder sling 24 hours a day to avoid movement in the left shoulder. Option B. Rest the left arm across the patient's lap while in bed and seated in a wheelchair. Option C. Position the arm to avoid traction of the left shoulder muscles while in bed and seated in a wheelchair. Option D. Rest let arm in should extension and adduction. The correct answer is option Nan. Placing the arm in a position that minimizes constant pulling on the shoulder muscles, from the weight of the arm, is the most appropriate way to treat the subluxed shoulder. Question 115. Neurological. When functioning at Rancho Level 6, you would expect a patient to require which of the following levels of assistance for daily living skills? Option A. Maximal assistance. Option B. Moderate assistance. Option C. Minimal assistance. Option D. Standby assistance. The correct answer is option Nan. Reference: Fleming Castaldi, R.P., 2009. National Occupational Therapy Certification Exam Review and Study Guide. p.156, Table 5-4. Question 116. Orthopedic. You are completing an evaluation of a patient, Ms. Althey-Tanthensum, who is complaining of intermittent bilateral hand numbness and tingling that happens on a daily basis. She explains that she has been feeling very clumsy lately because she is constantly dropping small objects at work. She also reports experiencing nocturnal hand pain and paresthesia which wakes her up at night, but feels better after shaking or massaging her hands. During your observation, you notice thenar eminence atrophy of both of her hands. You suspect that Ms. Althey-Tanthensum's symptoms are consistent with carpal tunnel syndrome, CTS. Which of the following would assist you in further screening the patient for CTS? Option A. Phelan's test. Option B. Froment's sign. Option C. Tinel's sign of median nerve distribution. Option D. Both A and C. The correct answer is option A. Phelan's test. Carpal tunnel syndrome is the result of median nerve compression in the carpal tunnel of the hand. For answer A, Phelan's test, aka the wrist flexion test, involves placing the wrist in a position of full flexion for 1 minute and asking the patient to describe any changes in sensation during or after this posture. A positive response involves patient report of numbness and tingling in the median nerve distribution of the hand. For answer B, Froment's sign is observed when there is flexion of the IP joint of the thumb as the flexor pollicis longus attempts to compensate for the paralyzed or weak adductor pollicis and flexor pollicis brevis and is indicative of an ulnar nerve lesion. For answer C, Tinel's sign occurs when there is gentle percussion along the course of the median nerve and tingling persists for several seconds along the median nerve distribution of the hand. Since both the Phelan's test and the Tinel's sign indicate median nerve compression, answer D is the correct choice. Question 117. Pediatrics. A mother reports that she is worried that her 14-month-old has delayed oral motor skills due to his eating habits. He holds and tries to eat a cracker but sucks on it more than bites it, consumes soft foods that dissolve in the mouth, and grabs at his spoon but bangs it or sucks on either end of it and does not attempt to bring spoonfuls of food to his mouth. Her 14-month-old is at the level of A, N. Option A, 5 to 7-month-old. Option B, 6 to 8-month-old. Option C, 6 to 9-month-old. Option D, 9 to 13-month-old. The correct answer is option C, 6 to 9-month-old. Answer C. A 14-month-old should be dipping his spoon in his food and bringing spoonfuls of food to his mouth, with a lot of spilling. A 5 to 7-month-old should be taking cereal or pureed baby food off of a spoon, a 6 to 8-month-old should attempt to hold their own bottle, and a 9 to 13-year-old should finger feed themselves portions of soft table foods and dry cereal. Reference: K. Smith and O'Brien, Occupational Therapy for Children, 6th edition, page 453-inch. Question 118. Neurological. Damage to the right hemisphere would result in the following symptoms except: Option A. Left motor praxis. Option B. Emotion. Option C. Speech. Option D. Visual spatial processing. The correct answer is option Nan. Speech is primarily controlled by the left hemisphere of the brain, especially in right-handed individuals. Damage to the right hemisphere typically affects left motor praxis, emotion, and visual spatial processing. Question 119. Management and evidence. According to the evidence, which of the following intervention plans is likely to be most effective in preventing falls in older adults? Option A. Designing a home exercise program to improve balance. Option B. Perform a home evaluation to address environmental hazards. Option C. A program to assess self-efficacy, physical activity, fear of falling, strength, balance, and environmental risks. Option D. Maximize ADL function and improve leisure participation to decrease depression. The correct answer is option Nan. All interventions are appropriate, but evidence has shown that interventions addressing multiple risk factors present in the older adult at risk for falls are most effective in the prevention of falls. Coppola, S. Elliott, S. J., and Toto, P. E. 2008. Strategies to Advance Gerontology Excellence. Bethesda. Question 120. Neurological damage to the right hemisphere would result in the following symptoms except Option A, left motor praxis. Option B, emotion. Option C, speech. Option D, visual spatial processing. The correct answer is option Nan. Neurological Rehabilitation, 5th edition. Umfred, D. A. Mosey, 2007. Question 121. Management and evidence. Prior to discharging a patient with a mental illness back into the community, it is important to assess how independent an individual will be with IADLs or ADLS and how much assistance they will need. Which assessment does not evaluate how independent an individual will be within their home following discharge? Option A, Kitchen Task Assessment, KTA. Option B, Executive Function Performance Test, EFPT. Option C, Coleman Evaluation of Living Skills, CALS. Option D, Feasibility Evaluation Checklist, FEC. The correct answer is option Nan. Feasibility Evaluation Checklist, FEC. The FEC, in the most general sense, measures how acceptable an individual will be as an employee. The KTA, EFPT, and CALS all evaluate ADL performance, evaluating cooking, self-care or telephone use in individuals with mental illnesses. Question 122. Pediatrics. A mother reports that she is worried that her 14-month-old has delayed oral motor skills due to his eating habits. He holds and tries to eat a cracker but sucks on it more than bites it, consumes soft foods that dissolve in the mouth, and grabs at his spoon but bangs it or sucks on either end of it and does not attempt to bring spoonfuls of food to his mouth. Her 14-month-old is at the level of A.N. Option A, 5 to 7-month-old. Option B, 6 to 8-month-old. Option C, 6 to 9-month-old. Option D, 9 to 13-month-old. The correct answer is option C, 6 to 9-month-old. Answer C. A 14-month-old should be dipping his spoon in his food and bringing spoonfuls of food to his mouth, with a lot of spilling. A 5 to 7-month-old should be taking cereal or pureed baby food off of a spoon. A 6 to 8-month-old should attempt to hold their own bottle, and a 9 to 13-month-old should finger feed themselves portions of soft table foods and dry cereal. Reference, K. Smith and O'Brien, Occupational Therapy for Children, 6th edition, page 453-inch. Question 123. General rehab. Your patient has had a decline in ADL performance at the SNF. You notice her endurance has significantly decreased since the last time she was on caseload. Which of the following would you not use to increase endurance for ADL performance? Option A, increased repetitions. Option B, increased duration of activity. Option C, increased resistance. Option D, work at 50% maximal resistance or less. The correct answer is option C, increased resistance. Answer C. Increased resistance works on strengthening citation, PG 236 of National Occupational Therapy Certification Exam Review and Study Guide, Therapy Ed. Question 124. Management and evidence. A child with a brachial plexus injury at your outpatient facility has begun to develop contractures in the left elbow. Using your clinical judgment based on current research trends, you decide to treat the patient with the following. Option A, prom once a day at therapy and school. Option B, serial casting to regain the full ROM, then maintenance ROM stretching. Option C, nighttime splints to maintain the current ROM the patient has. Option D, a combination of serial casting and nighttime splinting to initially regain full ROM and then maintain it in the future. The correct answer is option Nan. Source, Scheffler, L. C., Ladanza, L., Hagar, Y., Bagley, A., James, M. A., 2012. The prevalence, rate of progression, and treatment of elbow flexion contracture in children with brachial plexus birth palsy. Journal of Bone and Joint Surgery, 94, 5, 403-409. Question 125. General rehab. Your patient recently had a pacemaker inserted and is now in your inpatient rehab unit for general debilitation. What activity should be avoided? Option A, UBA, arm bike. Option B, standing tolerance activity. Option C, shoulder arc. Option D, making a simple meal in the kitchen. The correct answer is option Nan. When a pacemaker is placed, the patient should avoid ROM above 90 degrees and lifting more than 5 pounds for the first 6 weeks after placement. Question 126. Neurological. What does a score of 9 mean on the Glasgow Coma scale? Option A, minor brain injury. Option B, moderate brain injury. Option C, severe brain injury. Option D, fully conscious. The correct answer is option Nan. B is the correct answer. Scores of 9 to 12 are moderate, scores 13 and higher are minor, and scores of 8 or lower is severe. The Glasgow Coma scale is out of 15 total points. Source, Occupational Therapy for Physical Dysfunction. Question 127. Pediatrics, a 7-year-old child on your caseload is presenting with sensory processing deficits. Which evaluation would be the most appropriate to use? Option A, Sensory Integration and Praxis Tests, SIPT. Option B, Digani-Burke Test of Sensory Integration, TSI. Option C, Test of Sensory Functions in Infants. Option D, A and B. The correct answer is option A, Sensory Integration and Praxis Tests, SIPT. Answer A, SIPT ages 4 to 8, TSI ages 3 to 5, Sensory Functions in Infants 1-18 months, Fleming Castaldy, R. 2009. National Occupational Certification Exam, 5th edition, pages 258 to 259. Question 128. General Rehab. You perform a manual muscle test on Nathan, a 69-year-old patient who demonstrates full ROM and is able to withstand minimal resistance. The results of his manual muscle test show depict Nathan is option A 2+, P+, option B 3F, option C 3F, option D 3+, F+. The correct answer is option NaN. Based on the information provided, Nathan is able to withstand minimal resistance during the manual muscle test, indicating that he has good muscle strength. The plus sign indicates that his muscle strength is slightly above average. Therefore, the correct answer is 3+, F+. Question 129. General Rehab. When advising a patient with a higher level PSI how to provide pressure relief seated in their wheelchair for the first time, which is not the safest recommendation? Option A, lean forward so their chest is resting on their thighs. Option B, tilt the back of the chair as far back as possible. Option C, lean to the right, then to the left. Option D, get back in bed and perform bed mobility to the left and right. The correct answer is option A, lean forward so their chest is resting on their thighs. Because soon after a PSI, patients have trouble regulating blood pressure, and leaning forward can lead to dizziness, nausea and loss of consciousness. Question 130. Orthopedic. When adhering to hip precautions after a THR, which of the following would be an appropriate OT treatment? Option A, BUE strengthening exercises. Option B, strengthening exercises of affected LU. Option C, instruction and practice the use of AE for lower body dressing. Option D, transfer training with tub bench and getting on and off toilet with raised toilet seat. The correct answer is option F. Instruction and practice the use of AE for lower body dressing and transfer training with tub bench and getting on and off toilet with raised toilet seat. Rationale. Role of occupational therapist is to adhere to hip precautions after surgical repair of hip fractures. In order for the patient to continue ADL independence, instructing the patient with lower body dressing using AE allows the patient to complete the tasks being modified independent. In addition, the patient needs to be able to complete tub transfers safely and use a raised toilet seat while adhering to hip precautions. Strengthening of BUE and/or exercises for affected hip could be an appropriate treatment, however, this is not relevant to hip precautions. Source: National Occupational Therapy Certification Exam Review and Study Guide 5th edition by Rita P. Fleming Castaldy, page 140. Question 131. Neurological. Which of the following would you least likely observe following a CVA occurring in the middle cerebral artery? Option A, sensory deficits. Option B, language deficits. Option C, ataxia. Option D, contralateral hemiplegia. The correct answer is option NaN. William and Spackman, S. Occupational Therapy, B. 10. Question 132. Neurological. How can a therapist differentiate between visual field cuts and unilateral neglect? Option A, patterns during scanning task. Option B, convergence. Option C, peripheral vision tests. Option D, A and C. The correct answer is option NaN. Lori Lundy Ekman, 2007. Neuroscience Fundamental for Rehabilitation 3rd edition. St. Louis, Missouri, Saunders Elsevier, 230. Question 133. Pediatrics. A 7-year-old child on your caseload is presenting with sensory processing deficits. Which evaluation would be the most appropriate to use? Option A, Sensory Integration and Praxis Tests, SIPT. Option B, Digani-Burke Test of Sensory Integration, TSI. Option C, Test of Sensory Functions in Infants. Option D, A and B. The correct answer is option NaN. A. SIPT ages 4 to 8, TSI ages 3 to 5, Sensory Functions in Infants 1-18 months, Fleming Castaldy, R. 2009. National Occupational Certification Exam, 5th edition, pages 258 to 259. Question 134. Orthopedic. Which provocative test would not be used when evaluating de Quervain's tenosynovitis? Option A, look for pain with resisted thumb extension or abduction. Option B, thickening/swelling over first dorsal compartment. Option C, Cousin's test. Option D, Finkelstein's test. The correct answer is option Nan. Since de Quervain's affects the first dorsal compartment, abductor pollicis longus and extensor pollicis brevis are there, swelling and pain in that area, think, snuffbox, radial styloid area, are indicators. Finkelstein's is the test where they grab their thumb with their fingers, then move hand toward ulnar deviation. Pain in the radial styloid/radial wrist/thumb area is a positive test. Cousin's test is a test of the elbow, which is not directly involved in de Quervain's. Fundamentals of Hand Therapy, Cynthia Cooper. Question 135. Neurological, which of the following are you least likely to observe following a CVA occurring in the middle cerebral artery? Option A, sensory deficits. Option B, language deficits. Option C, ataxia. Option D, contralateral hemiplegia. The correct answer is option Nan. Rational, symptoms of a CVA occurring at the middle cerebral artery include contralateral hemiplegia, contralateral hemianopsia, sensory deficits, and language deficits. Source, Willard and Spackman's Occupational Therapy, d. 10-inch. Question 136. Orthopedic, which of the following would not be therapeutic priorities following an above-knee amputation? Option A, standing balance. Option B, upper extremity strengthening. Option C, adaptive grooming techniques. Option D, functional mobility. The correct answer is option Nan. Rational, a lower extremity amputation alters one's center of balance, therefore standing balance and endurance should be a priority. Upper extremity strengthening is important due to increased dependence on the arms following a lower limb amputation. Functional mobility will certainly change and should be a priority in occupational therapy as well as in physical therapy. One would not expect to see a change in grooming techniques as grooming is performed using the upper extremities, which are not impaired in this case. Source, Willard and Spackman's Occupational Therapy, d. 10-inch. Question 137. Management and evidence. OTs commonly assess peripheral nerve function with screening tests. The best way to test for radial nerve function would be to have the patient perform. Option A, wrist extension. Option B, gross grasp with dynamometer. Option C, pincer grasp with index and thumb. Option D, thumb opposition. The correct answer is option Nan. To test for radial nerve function, the best way would be to have the patient perform wrist extension. The radial nerve is responsible for extending the wrist, so testing this movement can provide information about the function of the nerve. The other options, gross grasp with dynamometer, pincer grasp with index and thumb opposition, are not specific to radial nerve function and may involve other nerves or muscle groups. Question 138. General rehab. Which of the following statements is not true regarding serial casting in individuals with traumatic brain injury? Option A, 2 to 3 joints may be cast at a time to increase UE-PROM. Option B, a serial casting program is indicated when moderate to severe spasticity cannot be managed by splints. Option C, cast should be left on for 5 to 7 days before the next successive cast is applied until a functional joint range. Option D, if skin breakdown occurs, the cast must be removed until the skin has healed. In this time, spasticity will increase. The correct answer is option Nan. The casting of more than one joint at a time often leads to skin breakdown as a result of multiple pressure points. It is thus recommended that casting be applied to one joint at a time. Pedretti, L. W., Pendleton, H. M. H., and Schultz-Krohn, W. 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction. St. Louis, M. O. Mosby/Elsevier. Question 139. Neurological. Which of the following would you least likely observe following a CVA occurring in the middle cerebral artery? Option A, sensory deficits. Option B, language deficits. Option C, ataxia. Option D, contralateral hemiplegia. The correct answer is option Nan. William and Spackman, S. Occupational Therapy, B. 10. Question 140. Neurological. Your client at a SNF is recovering from a right CVA infarct. She presents with severe left hemiplegia, resulting in poor trunk control and flexidity of her left UE. After assessing scapular movement during PROM, you find that she has no upward rotation of her scapula or external rotation of the humerus. Based on proper handling techniques of a hemiparetic upper extremity, what should be avoided when handling your client's affected UE? Option A, having the client self-manage ROM and positioning of her affected arm. Option B, utilizing PROM and AROM of the affected arm in full shoulder flexion and abduction. Option C, placing tape on the shoulder and scapular for support. Option D, utilizing the gait belt, not her affected arm, to assist her in moving her body during movement. The correct answer is option B, utilizing PROM and AROM of the affected arm in full shoulder flexion and abduction. Answer B. Shoulder ROM beyond 90 degrees of flexion and abduction should be avoided unless there is upward rotation of the scapula and external rotation of the humerus. Woodson, A.M., 2008, stroke. In M.D. Radomski and C.A.T. Latham, eds, Occupational Therapy for Physical Dysfunction, pages 1001 to 1041, Baltimore M.D. Lippincott Williams and Wilkins. Question 141. Neurological. A patient has been diagnosed with a right hemisphere cerebral vascular accident. Of the symptoms listed below, which would not be a deficit this patient would have? Option A. Visual spatial processing deficits. Option B. Trouble interpreting abstract information. Option C. Bilateral motor praxis deficits. Option D. Deficits with nonverbal memory. The correct answer is option Nan. C. Bilateral motor praxis deficits occur with left CVA. National Occupational Therapy Certification Exam Review and Study Guide, 5th edition, Rita P. Fleming Castaldi Copyright 2009 International Educational Resources, Limited. Question 142. Orthopedic. The supraspinatus is one of four muscles part of the rotator cuff. What is the action of this muscle? Option A. Abduct arm, stabilize humeral head in glenoid cavity. Option B. External rotation, stabilize humeral head. Option C. Internal rotation, stabilize humeral head and adduct arm. Option D. None of the above. The correct answer is option Nan. The supraspinatus muscle is responsible for abducting the arm and stabilizing the humeral head in the glenoid cavity. This means that it helps to move the arm away from the body and keeps the head of the upper arm bone in place within the shoulder joint. Question 143. General rehab. Which of the following is not a possible contraindication for ultrasound use? Option A. Pregnancy. Option B. Impaired cognition. Option C. Metastases. Option D. Scar tissue. The correct answer is option Nan. Rationale. Application of heat or cold directly over pregnant uterus is contraindicated, but application to other areas is not. Impaired cognition may affect ability to communicate discomfort. Application of heat or cold directly over a metastasis is contraindicated because it could potentially increase circulation to the area, so might enhance growth or spread malignancy to other tissues. Application to scar tissue promotes the healing process and can facilitate resolution of inflammatory phase of healing. Information obtained from OT 743 Assessment of Physical Function and OT Course Packet. Question 144. General rehab. Handling techniques used in the NDT approach are utilized to obtain all of the following except: Option A. Normalization of movement patterns. Option B. Increasing range of motion. Option C. Facilitation and inhibition of muscle groups. Option D. Increasing associated reactions. The correct answer is option D. Increasing associated reactions. Answer D. NDT techniques are used to provide external stability during movement, normalize movement patterns, facilitate or inhibit specific muscle groups, inhibit abnormal patterns of control, provide sensory input, increase range of motion, dissociate body segments, and normalize tone. NDT tries to decrease associated reactions by assessing the situations that evoke them and reducing the demand of the task. Fleming Castaldi, R.P., 2009. National Occupational Therapy Certification Exam Review and Study Guide, Evanston, Illinois. Therapy Ed. Question 145. Orthopedic. An OT practitioner is fabricating a static splint that will assist with the maintenance of a functional hand and finger position while keeping the soft tissures of the hand in mid-range position. Which splint would the OT most likely select to address these needs? Option A. Bivalve cast. Option B. Resting pan splint. Option C. Dynamic extension splint. Option D. Wrist cock-up splint. The correct answer is option Nan. It is the most appropriate to fabricate to maintain a functional hand position. The bivalve cast is typically used when circumferential pressure of a body part is required to maintain a desired position. The dynamic extension splint is not considered to be a static splint and incorporates outriggers to maintain a functional hand position. A wrist cock-up splint does not impact the position of the entire hand since it ends at the MCP crease. Reference Pedretti, L.W. and Early Me, Occupational Therapy Practice Skills for Physical Dysfunction, ed. 5. C.V. Mosby, St. Louis, 2001. Question 146. General rehab. An individual had a coronary artery bypass graft 5 days ago. His cardiologist approved his activities at a MET level of 2 to 3. What would be an appropriate activity for this individual? Option A. Vacuuming. Option B. Showering standing. Option C. Grooming at the edge of bed. Option D. Grooming while standing at the sink. The correct answer is option Nan. An individual who had a coronary artery bypass graft 5 days ago and has been approved for activities at a MET level of 2 to 3 needs to engage in activities that are light to moderate in intensity. Among the options provided, grooming while standing at the sink would be the most appropriate activity. This activity requires minimal exertion and can be performed while maintaining a comfortable standing position, allowing the individual to gradually increase their activity levels without putting excessive strain on their cardiovascular system. Question 147. General rehab. Which of the following is an appropriate assessment to administer to a teenager, 13 to 18 years old? Option A, Berry VMI, Visual Motor Integration. Option B, PDMSII, Peabody. Option C, SIPT, Sensory Integration and Praxis Test. Option D, Battelle Developmental Inventory, 2nd edition. The correct answer is option Nan. Rationale: VMI equals ages 2 years 0 months, 18 years 11 months, Peabody equals 1 month, 71 months, 5 years 11 months, SIPT equals 4 years, 8 years 11 months, Battelle equals birth, 8 years. Source, test manuals. Question 148. Neurological. You are evaluating a patient whose chart says he has been acutely diagnosed with a Brown-Séquard spinal cord injury. What deficits can you expect to see during your evaluation? Option A, paralysis and complete loss of pain, temperature, and touch sensation below level of lesion. Option B, paralysis and partial loss of pain, temperature, and touch sensation above level of lesion. Option C, motor paralysis and loss of proprioception on the ipsilateral side and loss of pain, temperature, and touch sensation on the. Option D, motor paralysis and loss of proprioception on the contralateral side and loss of pain, temperature, and touch sensation on the. The correct answer is option Nan. Pendleton, H. M., and Schultzkrohn, W., eds. 2006. Pedretti's Occupational Therapy, Practice Skills for Physical Dysfunction. St. Louis, Missouri. Mosby Elsevier, 906. Question 149. Pediatric. An infant has been referred to you from the doctor with a prescription that says, diagnosis cerebral palsy, OT evaluate and treat. What occupation is most important to start with? Option A, rum. Option B, feeding. Option C, play. Option D, self-care. The correct answer is option Nan. This is because self-care skills, such as feeding, dressing, grooming, and toileting, are fundamental activities of daily living that are essential for the child's independence and overall well-being. Addressing self-care needs is often a priority in pediatric occupational therapy to promote the child's functional independence and participation in daily life activities. Question 150. General rehab. Which of the following would produce the least amount of muscle atrophy in a patient with a spinal cord injury? Option A, do nothing, let the body heal itself. Option B, non-loaded, against no resistance, functional electrical stimulation. Option C, loaded, against resistance, functional electric stimulation. Option D, PROM. The correct answer is option Nan. Answer: C. FES against resistance has shown to put the most force on the muscles, causing the muscles to experience less atrophy than FES against no resistance and other treatments without electrical stimulation to the muscle fibers.